Hi guys, it's Dr. YouTube here, where I upload medical educational videos, uh, productivity skills, life of doctor, and cooking. So in this episode, I will talk you through the thyroid anatomy, physiology, and also what can go wrong, pathology. Visit my website medicforyou.webs.com and medicsforyou.webs.com, where you can learn about where I upload education revision notes I made as a medical student, suitable for medical students, nursing students, um, biomedical, and other allied healthcare professionals, including pharmacists and physiologists, etc. So, first of all, the thyroid gland. Thyroid gland consists of lobes, so right thyroid lobe, left thyroid lobe, and connected in between is the isthmus. Okay, right, left, in between isthmus. The predominant cell in the thyroid gland are the follicular cells. Okay, follicular cells, and then there's the colloid. The follicular cells produce thyroid hormone itself through an enzyme called thyroid peroxidase. Interspersed between the follicular cells are the clear cells, also known as the C cells, as you can see there. And they produce a hormone called calcitonin, which reduce calcium levels. So follicular cells, colloid, C cells producing calcitonin. We'll briefly touch on the pathway, the feedback loop. And we just ignore some of these labels there. So, the pituitary gland is stimulated by hypothalamus. So, if you imagine hypothalamus, pituitary gland, and thyroid, hypothalamus produces the thyroid-releasing hormone, TRH. Pituitary gland produces hormone TSH, and the thyroid gland produces T3 and T4. So, hypothalamus, TRH, pituitary gland, TSH, thyroid gland, T3 and T4. And free T3 and free T4 inhibits TSH and TRH release. So just stick that in mind. Moving on, you've got the main glands. So in terms of how the thyroid hormone is produced, well, the main active thyroid hormone is T4 actually. The majority of thyroid hormone that's produced is T4, but the active hormone is actually free T3. Okay, so T4 is converted in the peripheral tissues such as the liver, the muscle, the kidneys into T3. How does it do it? Well, first of all, let's look at how thyroid hormone is first produced. So you have got the enzyme, as we said before, in the follicular cells called thyroid peroxidase. And what it does is it is involved in the iodination of tyrosine residue and thyroglobulin. So if you remember here, you've got your thyroglobulin. And there you've got your MIT, so the thyroid residue containing one iodine, so mono, it's one, you've got your MIT, you've got DIT, which is two, so dual. You've got your MIT and DIT, so MIT is one, DIT is two. It couples MIT and DIT, so one plus 2 makes 3. So I've got your T3 formed there. It also couples DIT plus DIT, so 2 plus 2 equals 4. So it makes T4. So basically, it forms the core of the components, MIT and DIT, and it couples the individual components to form free T3 and free T4. Right. So, as we said before, the major thyroid hormone that's produced is T3, but the active one is actually T. Major component is major thyroid hormone is T4, but the active one is actually T3. The deiodinase enzyme is what, so it takes out an iodine component from T4 to form T3 to make it active. So, how does the thyroid hormone work in our body? Well, it crosses membrane of the cells and forms heat. And that's what makes our body active. So if you remember the 4 B's, it upregulates beta receptors to form the sympathetic response. It is involved in bone catabolism. So if someone who is an overactive thyroid gland producing in excess of thyroid hormone can have osteoporosis. It is involved in brain maturation and also in the metabolic rate. So someone who has an excess of thyroid hormone can lose weight, for example. Now, let's look at pathology. What happens if you have an overactive thyroid gland? Well, you can have a lot of sweating, increased appetite, weight loss. You can also have an enlarged gland. And the treatment for it, well, medication. So medication to inhibit thyroid peroxidase. Do you remember? Thyroid peroxidase is the enzyme involved in forming the core components, MIT, DIT, and also coupling between them to form the T3 and T4 component. So through medication, okay, that's the first role. The second method of controlling an overactive thyroid gland is through radioactive iodine, effectively destroying the thyroid gland. And last but not least, surgery would be the option of last resort in many cases. The 2 main causes of an overactive thyroid gland is an autoimmune cause, a Graves' disease. So you imagine Graves' disease, G, it's IgG mediated, causing constant stimulation to produce T3 and T4. Okay, you've got Graves' disease. You also, the second most common cause of an overactive thyroid gland is toxic multinodular goiter, where you've got an excess of, if you imagine the cell type, so large colloids, multiple nodules of these, so that's a multinodular goiter. What happens if you've got an underactive gland? Well, as we said before, it is involved in things such as sympathetic response, such as brain formation, metabolism. So someone who is hypothyroid at birth, known as cretinism, can have, for example, heart failure due to reduced heart rate, brain damage, okay, so learning disability, no bone growth, so they could be short and fat. As we said before, also it affects one's metabolism, so they may have weight gain. the treatment for it would be replacement, so free T4. Now the half-life of T4 is longer than that of T3. So usually T4 is just taken once a day, whereas free T3 could be 3 times a day, for example. So I hope you found this video useful. Just a quick recap, okay, in terms of the anatomy: right thyroid lobe, left thyroid lobe, isthmus connection in between. The main cell type are follicular cells and your clear cells. Follicular contains the hormone thyroid peroxidase, which is involved in forming MIT, DIT, and the formation of T3 and T4. Clear cell is involved in calcitonin production, which lowers calcium level. You can have, it controls the 4 B's, if you remember, so the metabolism, brain maturation, bone catabolism, and beta upregulation, the sympathetic response. The majority of thyroid hormone is T4, but the active one is T3. And also, you can have an overactive gland. The treatment for it is either always think about medical, surgical, or radioactive iodine. You can also have an underactive thyroid gland. The treatment for it is replacement. Take care and look after your thyroid gland. Take care.